So welcome to the Clinical Coach Project. My name is Dr. Adam Schulte. We're sitting here live at the Drop-In Doc conference room table. And what we're doing this video for is involving the merging of healthcare and fitness. Obviously, that's the premise of the start of the program. But really, it's the development of this program that's of highest utility and importance. So we're going to go around the table, introduce ourselves, a little bit about our background, and then talk a little bit about what we're individually looking to contribute to the program and some of the subject matters that we'd like to introduce to you, as well as the community, and hearing back from you guys is what would be interest of you. So starting all the way on the opposite side, take it away, Colin.
My name's Colin, head coach here at Resolution CrossFit, and been working here for 7-8 years. I also have my degree in strength conditioning from Cal State Fullerton, and pretty much sums it up.
There he is, head coach,
Yes.
Coach Colin. My name is Matt. I am the owner of Resolution CrossFit. I've been in the fitness industry now for about 16 years. Owned the Resolution CrossFit for about 10 years now. We got a second location in Brea, and my staff, except for Dr. Schulte, he's not my staff. Not yet. I'm gonna get him soon.
Well, my name's Alex Weber. I've been a coach here for about 7 months. Yeah, 7 or 8 months. Hoping to just bring in my own input, my own background, see where we go from there. I'm in school for kinesiology as well.
As I mentioned before, I'm Dr. Adam Schulte. I'm board certified in family medicine, fellowship trained in sports medicine. I received additional training in aesthetic medicine.
Dude, whatever.
Letters.
All look bad.
Get to the point. Founder president of the Drop-In Doc, and really thrilled to be able to bring this program together with Resolution CrossFit and develop this team-based collaborative platform for you all.
Alright, well, I can't beat that. My name's Alex. I'm 27 years old. I currently coach for Resolution CrossFit. I have previous medical background. I worked 3 years on a 911 ambulance for Anaheim, and I worked 2 years in the ER, in an ER receiving in Anaheim as well. So I can kind of correlate both the coaching and somewhat understand Dr. Adam between his tangents. So
Diatribes.
I'm the middleman, kind of relating.
And the media guy.
And the media.
And the media guy.
Super important. Left that part out, man. We wouldn't be doing the show if it wasn't for the media guy.
That's the first take, yeah.
So I'm going to be your medical maitre d' for the day. We're each going to take turns being kind of the moderators. But for today, this being the intro, thought we'd go around and what do you guys really hope to change? Because obviously we talked about our respective industries where the Globo Gym industry has really failed as far as achieving meaningful health and wellness, where the healthcare industry has failed achieving meaningful health and wellness. But combining both the elements, the working elements of both that are the most successful into one combined collaborative program, where do we go from here? What do we look to build? What do we look to bring?
I think one of the most important things to build is a place, a platform, and a resource for the community at large to come and have a place where they can see both perspectives. They can see what the coach side of things are, they can see what the medical side of things are, and they can see how we can join the two together to answer whatever questions that they may have, whether it's why is functional training important for me, or where do I start with my nutrition. If I don't have any background, they can come to a resource that they can easily get answers, they can connect with, and it's just there for them. There's no catches, there's no gimmicks, it's just the truth.
I think, piggybacking off of that, our goal is to provide cohesiveness with different communities. Is the ability to not only provide cohesiveness from what we do inside the gym to medical doctors, but other practitioners, physical therapists, orthopedic surgeons, anybody that's in a medical field. There's a way that all of these fields can be brought together, and the more that they work together, we work together, the better basic product we're going to provide for everybody out there, whether they come off the streets, having a professional sports background, having a high school sports background, anything, they can come in and get information, and people are on the same page when it comes down to it.
And Alex, you and I have talked about that as far as the disjointedness and that interrupted game of telephone that the healthcare system currently operates between the patient being right in the middle, and how lost they get in the system and getting bounced from one provider to the next, and then they go to physical therapy, and physical therapy never sends their notes, or the orthopedist claims, I don't know what PT's doing for you, but keep going to PT, and PT says, I don't know why the orthopedic surgeon's sending you to us, but we're going to work with you as best we can. And then, like what Colin said is that where we have a roundtable group, we basically have a circle of communication with the patient in the middle, rather than them operating as like the intermediary go-between, that they're supposed to be fully knowledgeable about everything that's going on and why they're going through whatever protocol they're being put through, especially if they're not seeing like the end result that they were promised in the first place.
Correct. So to go off of what you were saying, I'm not sure if I mentioned before, but I was in EMT in the ambulance and in the ER. So when I worked in the ER, I would assist nurses and doctors. But a lot of the time, once the doctor goes sees the patient and they kind of go off and transfer their notes, there would be all these orders in that pretty much patients didn't know what was going on. Oh, like, why am I getting this? Or I didn't know I was getting this. Sometimes a lot of miscommunication. Sometimes things were explained where patients didn't even understand. So going off what you were saying, I saw that a lot, and I tried kind of doing my best to kind of relay the info or the message, like this is why it's going on, but just trying to stay within like my scope of practice. But yeah.
And I think Colin used a great term, is that's cohesiveness, is that you don't have that disjointedness in this kind of a pilot program, is that you have a fluid train of communication amongst like-minded individuals who have similar backgrounds with enough of an overlap to be able to speak a common language.
But I view this thing as is when we had our kids, you're at the hospital, you got the doctors and the nurses, and they're all helping you, and you feel very comfortable and relaxed. And then they say, it's been 24 hours, see you later, you're off on your own. And then now you have to go home and figure out how to take care of this tiny baby. I feel like it's the same thing between when you go and see your doctor and then you go and you have to start doing your own thing. You're done with your physical therapist and you have to now figure out how to do it on your own. I want this to be an amazing platform for people to transition from the doctor or their physical therapist into an active lifestyle, active healthy lifestyle. They can find those answers amongst this group and this platform. I think that would be an amazing thing, because we were a culture shock when we left the hospital and had to go home. Thank God for the family we have to help us out, but that in-between phase, like, oh my gosh, this is all on us now, like this would be an amazing platform to be able to kind of make people feel more comfortable now that they've left their physical therapist and now they can come to this.
And I think I've mentioned it to all of you as well before, is that what this program creates is the opportunity for coaches to finally be recognized and acknowledged as essentially ancillary healthcare providers. Is that if you guys are accomplishing more with your clients in the gym than we practitioners are in clinical practice, then intuitively it makes sense then, well, why wouldn't you want to utilize coaches as healthcare providers in that sense? And so Alex, for somebody who's a young coach who's just starting out on his own academic career, is what does that mean for you, being able to step in and be able to see that take shape, and where do you see that affecting your future?
I feel like it just provides a whole other avenue compared to where, like, being a CrossFit coach, like, you only have these levels of certification that you can go through, but having something where, like, that provides, like, a whole other realm of what we can do in this whole CrossFit community, or even health at large. You know what I mean?
Yeah, and obviously there are some topics, too, that are of great interest, and I anticipate we'll probably have quite a few comments listed below as far as what people really want us to tackle. And it's not meant to be that we're all going to adopt each other's opinions of anything. It's important to present differing opinions, even as strongly as you feel about one, to present something as a counterpoint and to suggest, well, from an opposing angle or from a different perspective. Coaches' perspectives are going to be different from healthcare providers, because you see things and do things that we're not present to do. And so it may seem easy to identify and say, oh, well, that's got to be the reason why. I mean, we've heard stories about docs being like, oh, well, CrossFit's horrible for you. I see so many injuries. Well, are you really seeing the injuries? Have you ever set foot in an affiliate before? Do you actually understand the methodology and the core principles of functional fitness? Have you ever seen guys like Jim Metcalf or Susie Metcalf?
The understanding of the methodology is the biggest thing. That people, they don't understand what the methodology is, so they see these YouTube videos, or they see the CrossFit Games or whatever it is, and then that's their perspective of what CrossFit is, and that's not it at all. CrossFit is not a competitive exercise program in any way, shape, or form. It has an avenue that you can take for that, but it's definitely not what it is. So that would be something that would be really exciting to address in one of these podcasts or interviews and talk about that. I think that would be something great. And there's another one that I hear often, a question that gets posed, or a statement that gets posed frequently when someone comes into our gym, especially from females, is they always say, I don't want to get big from doing CrossFit or lifting weights. Mm-hmm. And I would love to have a full conversation about that and why that is just not the case. So, I mean, I thought that would be something to talk about. What do you guys think? What are some things you would love to talk about?
I think I want to carry off with what what both of you, Matt and Adam, been going off of. But one of them would be like doctors, and doctors saying, "Oh, you shouldn't do CrossFit; it's bad for you."
Yeah.
And just relaying into like the simple fact of when you have a doctor that's overweight, it's hard. It's hard. No. Like,
I'm glad you waited until that
No,
it's like that place to go.
no, like seriously, it's so hard to take feedback from people like, "Oh, you know the goal is to work out and eat right, watch your nutrition." But when you have a doctor that's seriously overweight, borderline obese, or maybe obese, like it's hard to take in that info because you just visually you can't take that feedback from someone that if you're gonna play the role, like you gotta
Practice
look the
what you
part as
preach.
well and practice what you preach.
If you're gonna talk the talk, you gotta walk the walk.
Correct, and the same thing goes
Most
with
of these guys can't walk.
yeah. And the same thing goes not just with doctors, but like nurses as well. It's hard when you have patients with like whatever it may be, what diagnosis they may have, and you have nurses that are smokers, and then they preach, "Oh, you shouldn't be smoking. This is what's going on with your lungs. This is your diagnosis, yada yada yada." But on their break, they're walking off campus to smoke their cigarettes. So it's just one of those things. Like if you're gonna play
Diabetes is a huge thing, right?
Correct.
And these people are out eating fast food for lunch every day because their lives are too busy to be able to eat something healthy, but they're trying to pop you with medication or whatever else, right?
And then I think it carries on to like although that's your job, like once you clock off, like that doesn't mean like your job's done. Like or else you're just a nurse for the money, or else you're a doctor just for the money.
That never happens.
Like you gotta live that lifestyle if you're gonna be preaching that,
Yeah. There's an actual real world example. During my training in Columbus, Ohio, there was a cardiologist we had to rotate with who was 300 pounds and wore CPAP at night because his neck was so huge that it would compress on his pharynx, and he'd have apneic episodes where he'd be gasping for air. And I'd have to go in his clinic with him and listen to this guy, out of breath, shuffle into the room and tell his patients who had like heart attacks, strokes, etc., they had to lose weight. It's like, A, he doesn't give them any more specific example than that, is you need to lose weight, no guidance, no instruction, none whatsoever. And B, if you're that patient, seeing this guy telling you to lose weight, what's going to be your response?
Right.
Like, you have no faith in this physician who can't even do the same for himself, who looks like a ticking time bomb himself.
If you know it's so bad for you and you're not doing it, how am I supposed to be able to attack this? You obviously don't have a solution for me or anything that's actually going to work.
And I would love one of those patients to challenge him and be like, okay, great, how do you lose weight? Right? Like, what would you suggest as far as a good dietary program? And hear them try to pull, crazy stuff out of their ass, like what they see on TV. I don't know, try the keto diet. That sounds like it's successful. I know a couple people or celebrities that were on TV and swore by it. It's like, you're just latching on to what the general public does anyways. Another example I used is that, okay, let's say you have high cholesterol, and what we're asking patients to do is figure it out on their own. So if you have high cholesterol, and I say, okay, here's some asimvastatin, here's some Lipitor, and they go, okay, well, how do I take it? Figure it out. And so they're going to do the best they can. They're going to look on the label. They're going to try to figure out what the appropriate dose and how often they take it should be. But we're asking them to do the same thing with that exercise that without the doctor's further instruction, they're at their best devices to figure out on their own. So where do they tend to go? Here. This is where they get the instruction they need. And I think
we also have that huge thing that we have to overcome is where my doctor told me this. Right? And now that my coach is saying this, but my doctor is saying this, and we're giving advice, but they don't look at it at the same level as they would a doctor. We're just saying it, and I'll do some research off what you said, but my doctor said it, so now it's gold. This is all I can do because my doctor said that, but maybe I'll try this.
And that one example that I mentioned, the coach from Friendship, Ohio, going to a sports medicine doctor, thinking these guys are trained in like strength and conditioning research, right? They should know as far as periodization, they should know all the typical underpinnings of successful strength and conditioning exercise programming. And they get this broad brushstroke, just like the cardiologist gave that patient. It's just, you got to lose weight. Oh, well, that's horrible for you. Well, do you know anything about it? Do you do anything? What strength conditioning do you do? What sort of exercise programming do you routinely program for your patients? Unless it's the old saying is that if you don't use it, you lose it, right? And if we don't have the training to even put that into practice, then really how can you rely on the guidance of a physician if all they're giving you is their personal opinion, not their foundational professional opinion?
Yeah.
But because they're a doctor, it's their word is gold. Right? They can't possibly.
I think the idea is, this kind of like bringing it back to what we want to talk about is like bringing these conversations that everybody's thinking about, putting them on the table, and opening up discussion about it. I think piggybacking what you guys are saying is that there's this idea of like, well, coaches need to know when to refer out to doctors, right? And then on the flip side, there needs to be a back and forth as doctors need to know when to refer out to coaches and trusting people who are in that professional realm, because medical doctor is not the same thing as a strength and conditioning coach, CrossFit coach, any other type of practitioner. It's about opening having the ability to open up the conversation, not just a one-way ticket, but making it both ways, when it comes down to it, and providing conversations that give that little bit of pushback of what the status quo is of like the medical doctor opinion is like the end-all be-all when it comes down to it.
Probably the most important word that you use is trust. This creates an avenue for trust. Whereas before, it's like, unless you personally know that person, unless you know the individual coaches, can you really feel confident about saying, okay, I want you to go see these guys, I've heard of them, they do great work. It's like, no, you're just kind of going off of hearsay and whatever you can pull up on Google reviews, and none of these are definitively reliable. I mean, we've seen like things like Yelp and Google reviews. They're essentially just grievance pages for people to take out their hostility.
Yeah,
right.
They're not happy, and so you only see the worst of the worst.
Yeah.
But you don't have that foundational knowledge of like, well, have I met these guys? Have I worked with these guys? Have I referred people to them and gotten feedback from what their experience has been? It's like, no, there hasn't been a channel that allows for that until now, and just to watch that part of that grow. And I mean, we have probably, a handful of physicians, nurses, PTs who are already members of just our gym alone, but that's not unique just to our gym alone. You have that in multiple other gyms across the country.
Yeah.
And to be able to offer that too via virtual means is to be able to have them in and be able to have them contribute. And let's hear what you guys are doing successfully in Albany, New York, and Minneapolis, Minnesota. And there's a gym that's doing some phenomenal things down in Austin, Texas. And that's what we want. We want this to be a collaborative effort, not limited to just this table who can be physically present right here. But we're the moderators that want to be able to say, hey, we want to hear from you guys. What are you doing that's so successful, that's different and novel and innovative? And what results have you seen from it? And be able to introduce that to the rest of the community to make these individual small communities interconnected as one larger community.
And those gym communities, we like to hear from their community at large and find out what those people around them are interested in hearing about. And then we can pose that question amongst the group, invite other people in, and we can answer that question to the best of our abilities and hopefully be able to solve that problem for those people at large.
It builds everybody else's knowledge base. It basically
Absolutely.
creates this giant think tank that previously is, like you said, it's scattered in individual communities, but once you find the channels to be able to intercommunicate all of those, that's where really the power and utility of this program really stands to make a huge difference.
I think we should pose that question to the people that may watch this or the people that we share this with to put, like you said earlier in the comments, let us know what you guys want to hear about, and we'll hit every one of those questions.
Absolutely.
And then just to carry off like the topic we're going over, especially with Colin, but when relaying like fitness and coaching, and then the medical field, and then the miscommunication that crosses over, right? Because there is no real communication. I mean, doctors communicating with nurses and their techs and whatever it may be is bad as it's bad enough.
Yeah.
But the fact that we don't get the communication between, let's just use an injured member or patient, for example, right? They come in and it's that whole oh, I can't squat. Okay, this is an injury I have, but my doctor says I can't squat. In reality, unless there's a good reason why that should be a lifelong thing, you shouldn't squat. Is it really just miscommunication? Is it really like, no, you shouldn't be squatting right now, you should be going to therapy and doing this, or this is the plan for the next 12 to 16 weeks, whatever it may be.
Should be.
Opposed to, oh no, I'm not squatting, I wanna work out, lose weight, or live a healthy lifestyle, but my doctor said I can't squat, so that's the cutoff line.
It's like poses a blanket statement. You're no longer allowed to do this
Correct.
anymore, which
Correct.
is
A definitive versus
a temporary thing. We're going to work on fixing it, and then
Right.
here's your plan, and let's move forward. But that doesn't
Correct.
happen.
And in this case, let's say we have Adam's office right here. So it's like, in reality, it's almost like walking down 100 steps and being like, hey Adam, like, this is what I'm getting. What's really going on here? Oh no, that's not what I said. This is the problem that's going on. These are the steps I mentioned about going over, so we could eventually end up back to living a healthy, normal
I'm
lifestyle.
glad you mentioned that too, because one of the components of the patient agreement for the drop-in doc is that it gives me permission, the patients give me permission to communicate pertinent protected health information by HIPAA to the coaches, because it's relevant to what you guys are doing there. Now, like we were saying, is like, do you guys need to know if a patient had like a urinary tract infection or
Absolutely
or an
not.
infected toe?
You don't need to know.
Never.
Don't need to know.
Every time the answer is no. But if it's pertinent to, like, let's say a potential rotator cuff injury, and doing anything like repetitive volume snatch work at moderate or even lightweight could potentially exacerbate an issue. And maybe they didn't communicate it correctly. Like, every one of these coaches has my phone number, so if I'm not physically here or if they can't walk in and find me, they can always text me, call me, ask me, what can this person do today, what can they not do today, and what's the follow-up plan. So that way, everybody is the most knowledgeable, has the most current up-to-date information.
On that same scenario, we talked about doing another side of the clinical coach project is us working together to come up with a agreed solution for particular situations like that. So we can say, hey, based on my experience, based on your experience and our understanding, this is the protocol we should take for someone in that situation. And then they can also revert back to you and say, hey, how's this going? And back to us, and we can start moving them in the right direction, opposed to just saying, hey, I'm not supposed to do this stuff, and now they're going to leave it up to them to kind of make sure they're not doing those things. We're working together to make sure they're constantly moving forward now.
A structured plan that consists of measurable data, and that's really what the Drop-In Doc attempts to accomplish, is to take a population of motivated, adherent, compliant patients, which we've never had with the general population. It's just impossible. Like with the cardiologist saying, lose weight, you know that patient's not going to lose weight. But to be able to have that working, integrated relationship with a gym, and to have that data lean back on and produce powerful data that's even suggestive to the extent of that you can present that to like a journal and publish that and say, hey, with a controlled population, minimizing extraneous variables that could affect that data, where it's consistent data in a large enough population, like let's say 100, 200, 500, 800 people, and we compile all that data together looking at individual components. That's how we develop guidelines and treatment strategies, is that it's structured now. It's not just like, well, you know, maybe don't squat for 2 weeks. Well, like, where's that supported in the literature? Where is there literature studies that show that's an effective treatment strategy as far as rehab?
Another thing that's great about this is it doesn't have to be someone who's a member here or necessarily a patient of. With this platform, they can literally just contact us via whatever platform, Instagram, Facebook, YouTube, whatever it is, pose the question or their situation, and we're here to help. That's the point. We're just here to help and give them guidance and direction to solve their particular problem. So, I mean, it's amazing that we're able to do this amongst our community, but as we grow, we can do it to whoever has the issue.
As long as it's not about UTIs.
As long as we don't want to hear that stuff.
Yeah.
Absolutely not.
Nothing gross.
We can name a few others that we don't. So yeah.
Yeah, guys, I think we covered a lot of ground today. I think that's a pretty good introduction. Like we've been talking about, if you have any suggested topics that you'd like covered, please leave them in the comments section. We'll read every one of these over, talk about them as a group, see if we see any that come up more regularly, and obviously put a priority on those. We've got quite a few other ideas as far as guest hosts, as far as like the physical therapists and the doctors and the individual member spotlights that we have within our community, be able to highlight those and different features and segments that we can do. But please leave your comments below. We'd love to read them. And
like and share. Tell everyone. This is going to be the best podcast around.
Subscribe to the channel.
Subscribe to the
Yes,
channel.
there we go.
Tell your
Ring that
friends.
bell.
Share it at parties. All right, guys. Until next time, we'll call it a wrap.
Not at
Thank
parties.
you. Cool.
I think that was good.
Eventually, we'll have a blooper reel. I think would be worthwhile putting.
In the first 5 minutes, we may have had a little bit there.
How many minutes did we run?
It says 20.